All right. Welcome, everybody, to today's Workforce Wednesday webinar. My name is Antonio Gomez. I work for the Illinois Center for Specialized Professional Support based out of ISU. I will be your moderator and technical support for today. For today's session, make sure to hold all questions until the Q&A portion of the webinar or post them in the chat. We do also have a Q&A function at the bottom of the screen. So if you know how to use that, fantastic. Go ahead and use that. If you don't, ask me questions in the chat and I'm here to help. This webinar also offers closed captioning, and we will be recording this webinar. The webinar will be available within 48 hours business days on the Illinois Workforce Academy. And we will also be collecting questions for today to release a little bit of an FAQ. So without further ado, I'm going to get us started with a couple of polls. One is for your area and one is for what partnership you represent for us. So I will get those launched and then we will get started. All right. This first one, let us know what partner you represent or other. All right, looks as though we've got our responses. I'm going to end this poll. And it looks as though we've got a lot of Title I, a good amount of Title II, some Title III, Wagner Pfizer, some Title IV, and then other WIOA partners. And it looks as though we've got some people from Chicago, good amount of Chicago, some Northern, some Central, Southern Illinois, and statewide. So thank you so much for taking care of those polls. And without further ado, Sheena, take it away.
Yes, thank you, Antonio. Hello and good afternoon, everyone. Thank you for joining today's webinar on the Supplemental Nutrition Assistance Program, SNAP Federal Impacts on Illinois, and with the Illinois Department of Human Services. I'm Sheena Panor, the Associate Director in the Office of Workforce Development at IDHS. The Office of Workforce Development oversees two key programs, the SNAP Employment and Training Program, SNAP ENT, and our Temporary Assistance for Needy Families Employment and Training Program, or TANF ENT. Both programs, as you may know, are designed to support individuals who rely on our critical safety net programs by helping them gain skills, training, and supports to obtain living wage jobs and a career path, promoting economic mobility, and of course, working with you all to help meet state and local workforce needs. And so I'll be your host today as we walk through the recent federal policy changes that are impacting SNAP in Illinois, with a focus on the expanded SNAP work requirement and time limit for individuals who are identified as able-bodied adults without dependents, or ABODs, under federal SNAP policy. And so our goal today is to help you all by explaining what the SNAP work requirement is, when the work requirement and time limit will take effect, who will be impacted, what's required for them to maintain SNAP eligibility, and how we at IDHS are responding through outreach to our SNAP recipients and engagement with all kinds of community stakeholders like you all to support those who may be at risk of losing their food assistance as soon as May 2026. So as Antonio mentioned, I will be pausing at 3 moments during the presentation and to let you know to add your questions. All the questions that we're able to answer on the call, we will do so. Just know that the questions that we're not able to answer today, we will be compiling as part of that frequently asked questions document, and to make sure that we can share with you when we have those responses. As you can imagine, we're all working really hard to respond to the federal change and just needing to make sure we have full internal alignment with policy and our eligibility workers in the field, as well as all of you and leadership in different state agencies. And so we don't want to get ahead of communicating things where we don't yet have all of that internal alignment and policy research and all of that set in stone. So there might be some of those items that I'm not able to answer today, but we will take back those questions and work as hard and fast as we can to be able to share those responses for you all, because we know that you likely have a lot of questions. But hopefully we can answer a lot of your questions today live as well. All right, next slide, please. So we just want to start with a quick overview of SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps. As you may know, it helps our low-income people and families to buy the food they need for good health. Benefits are issued on the Illinois Link Card and can be used at most grocery stores. And eligibility is determined based on income, expenses, and household size. In Illinois, households may qualify with income up to 165% of the federal poverty level, or up to 200% if they include elderly or disabled members. And the program is federally managed by USDA, U.S. Department of Agriculture Food and Nutrition Service, and then locally administered here in the state by IDHS. And as I mentioned, we have our eligibility workers who are at the local DHS offices, known as Family and Community Resource Centers. We call them our FCRCs, and they are the ones who determine eligibility for SNAP. Next slide, please. And so in Illinois, we have one of the largest SNAP programs in the country. We issue more than $4 billion in SNAP benefits every year to nearly 2 million people. And many of our SNAP holds include older adults, children, people with disabilities, 44,000 veterans. So giving you just a snapshot of who we serve. Next slide, please. And with the expansion of the SNAP work requirement, we're anticipating that this will directly impact more than 340,000 of our SNAP recipients who are at risk of losing access to their benefits. And this in turn could result in wage losses of up to $1 billion annually across Illinois industries along the supply chain from farms to table. We want to just emphasize that, that it's SNAP benefits not only help our low-income food insecure families with being able to put food on their tables, but this also increases purchasing power and has that expanded impact again from farms all the way through to retailers. And so when there are cuts to SNAP, it really has that compounding impact in our communities. And so this threatens about $7.2 billion in positive economic impact for Illinois, and will have that compounded impact on more than 1.7 million Illinoisans who rely on both SNAP and Medicaid. And as you all know, I know you're well aware of this, but that these are not just numbers, these are real people, families, and communities that are at risk. And so really glad that you're all here today to have this conversation around what we can do. On the next slide, please. So on July 4th, the federal government passed H.R. 1. And in addition to changes to the SNAP work requirement and time limit that we'll go into in more depth, wanted to just make sure you're aware there were also changes that require states to cover part of SNAP benefits based on their payment error rate. And the design of this policy could cost Illinois over $800 million starting in 2027 and is a significant threat to the program in Illinois and nationally. And so while Illinois has a relatively low error rate, we are taking a lot of steps to reduce the error rate further through policy changes related to documentation and renewals. And we are communicating that information out to stakeholders as well. Next slide, please. So now we will focus on the impacts to the SNAP recipients who are identified, again, under the federal criteria as able-bodied adults without dependents, or ABODs, who are facing the expanded work requirement and return of the time limit. So I will give you an overview of ABOD policy in general and the exemptions or the reasons that someone may not have to meet the work requirement. Then I'll take a pause for questions about that section. Then I will go through what are the ways that an ABOD can meet the work requirement, and then also take a pause to get your questions. And then we have a section where we will talk through our plan at IDHS, working with you all, our workforce partners, and then also have an opportunity for questions. And then Lisa Jones, I will be turning to her at a couple of moments as well to chime in from her perspective on the presentation. Next slide, please. So going back to H.R. 1, we just wanted to flag the things that were changed, the expansions to the scope of the SNAP work requirement and time limit that were part of that law. So H.R. 1 increased the age range for ABOTS from 18 to 54 to now 18 to 64-year-olds. And then before, the time limit did not apply to adults in the same SNAP household as a child under 18, but HR1 changed this to children under age to children under age 14 in the SNAP household. And then before HR1, there were automatic exemptions in place for individuals who are homeless, veterans, or youth aging out of foster care. After HR1, those individuals do not get those automatic exemptions. They still could be exempt for another reason, and we will have that section where we go through those exemptions, but they don't have those automatic exemptions based on that criteria. And so those populations are really affected by that expansion. The HR1 also changed the threshold for requesting time limit waivers. So, Illinois has been under a time limit waiver, but with this change in the criteria, Illinois no longer meets the threshold and will not be able to request a waiver when our current one expires, which I'll go into the details about. Next slide, please. So of the almost 2 million SNAP recipients in Illinois, in looking at our data, about 20% were identified as ABOTS. When we get to the section on exemptions, I'll share how that number has been shifting as we are processing a lot of the requests for exemptions that have been coming in. But just sharing our initial data was showing that about 20% were identified as ABOTS. And of those ABOTS, about 80% were at risk of losing access to SNAP as soon as May 2026 because they were not meeting the work requirement at the time. Next slide, please. And just to give you some context, the Urban Institute had done a study looking at ABOTS when the time limit had returned in some different states previously. And they wanted to get a sense of when we talk about ABOTS, what are the characteristics of this population? Of course, just noting that this is before HR1. So again, it was before the expanded age range and some of those changes that were put into place. But what they found is that our ABOTS were managing multiple crises. They were navigating food and housing insecurity, mental and physical health issues, oftentimes in low-wage, unpredictable jobs. Many were disconnected from traditional communication pathways, so didn't have a regular mailing address, didn't have a regular phone number often, and especially in rural areas, and may have had challenging experiences with the educational system or workforce system, and therefore were disconnected and needing additional support to engage. And so just look, in that study, really flagging that a lot of these individuals who are ABOTS, they were doing their best and they were struggling to make those connections to the workforce system, but they were doing their best to navigate those different barriers and challenges. And so it was with that context that we, at IDHS, working with partners, are focusing on first educating our SNAP recipients and community partners on all of the allowable exemption pathways, which again we'll get into on the exemption section, because some of the issues that we're raising here about being in crisis, the housing insecurity, the mental and physical health barriers, could actually be exemptions. And so that's one opportunity, is making sure people understand the exemptions, how to request exemptions, and that we are first and foremost helping to exempt those who are unable to meet the work requirement. And then for those who are identified as ABOTS, working on a plan to help them to connect them with the right services to meet the work requirement. And so let me turn it over to Lisa Jones to weigh in on this slide.
Yeah, thanks, Gina, and thanks everyone for joining today. We really appreciate the opportunity to share this with you all and, let you know some ways that you can support our efforts going forward. I think as we were working with Sheena and her team on some steps or some things that we can all do to partner together to move this forward. I think it's really good for us and appropriate for us to be part of this effort because, as you know, in listening to Sheena talk, these customers really are, in most cases, can be our customers as well. And in some instances will fall within the priority of service framework that we have. So we wanted to make sure that you all knew, and we want to support you all as we work towards this population either meeting the work requirement or eventually moving towards self-sufficiency or becoming ready to work. So We are going to be talking about a little bit later as she goes into the exemptions and then some of our strategies. One way that we want to do this, because we are also very cognizant of all of our programs reporting requirements. So, and to be able to actually be responsive as immediately as possible to this population, we're going to take a virtual access approach for immediate engagement. So we'll talk more about that later, but just wanted to remind folks that these could potentially be in our priority of service framework. And also, what we can do to support them in the larger system and our larger workforce areas. So if you have questions about that later, we can answer any concerns that you might have as well from a Title I perspective. And if you could put those in the chat, we'll see about getting answers. And I am going to kick it back to Sheena.
Thank you, Lisa.
Sure.
Next slide, please. So here's what you need to know about the return of the time limit, and we'll dive a little bit deeper onto each of these things. But the SNAP time limit will return in Illinois on February 1st, 2026. Our current waiver will go through January 31st of 2026. And so that first month where ABODs could start having their months counted towards the time limit would be February 1st, 2026. You may have heard some different dates because there was some uncertainty about whether waivers were going to be lifted early or not. But based on some recent court decisions, our waiver will remain through end of January, and the time limit will return February 1st. And the time limit will apply to adults ages 18 to 64 who do not have a child under age 14 in their SNAP household, and we'll go through the other exemption reasons that would make the time limit not have to apply to somebody. And once again, our waiver expires in January, the 3-month time limit will start right away. So our local DHS offices, the FCRCs, they've already been screening for exemptions. We've been notifying our customers about the changes through various notices and different efforts and what they can do, and working with our community partners. And so again, we'll go through that exemption section in detail because all of you can also help us by playing a role in educating customers about what the exemptions are and how they can report them. And also we'll be working together on that plan for helping to connect ABODs to those qualifying work programs like our SNAP Employment and Training Program, WIOA Title I, and others. Again, we'll get into that a little bit later with Lisa. And just so you know, IDHS, we are developing tools to help ABODs find programs in their area and really provide clarity to all of you all on related exemption pathways and what those qualifying programs are. Next slide, please. So basically, when we talk about the time limit, what that means is that an ABOD, someone identified as an ABOD, they don't meet an exemption reason, they can only receive SNAP for 3 months in a 3-year period unless they're meeting the work requirement or they begin meeting an exemption reason. So that means, again, our ABODs could lose SNAP eligibility as soon as May 2026 if they are not meeting the work requirement or qualifying for an exemption, because that could be February, March, April. And so that first wave of ABODs are at risk of termination in May 2026 if they if they're not already meeting, or if they do not start meeting in that time. Once they get to their 3 months, they would lose eligibility for SNAP. But we did want to flag that there is a pathway for ABODs to regain eligibility. So even if an ABOD uses up their 3 months, they lose eligibility, there's a pathway for them to regain access to SNAP benefits at any time and as many times as they're able to meet the criteria to regain by either becoming exempt or meeting the requirement. So we'll talk about what that looks like, but, doing 80 hours and 30 consecutive days of, the qualifying activities, they could regain eligibility, or if they meet an exemption reason, they could regain eligibility as well. So, and one thing to clarify is, so we said, 3 months and 3 years, and each state has a different way that they track that 3 years. And the 3 years continues to run even when a state is under a waiver. So that's why in Illinois, our 3-year period actually started January 1st, 2024, and the 3-year period will end December 31st of 2026, which means on January 1st, 2027, all of our ABODs will get a clean slate and a new 3 3-year period will begin. And so again, that is because our 3-year period just continued to run even though we were under a waiver. Next slide, please. On this slide, we just wanted to share the copy of the SNAP Work Rules Notice, which is our Form 5175, because federal law requires that our eligibility workers at the FCRCs, when they're screening and they're determining eligibility and they identify individuals in the household who may be subject to the work rules, they are required to be verbally have the work requirement verbally explained to them, and they are also required to get this notice in the mail, and the notice will tell them who's subject to the work rules, how to meet the work rules, what to do if they start meeting an exemption or they have a good reason for not meeting the work requirement. And they will be getting this notice, when they first apply and are determined eligible, at their renewal, when someone who was exempt becomes subject to the rules, or a new person joins their household who's subject to the rules. So just wanted to let you know that, again, as part of the FCRC eligibility worker screening, identifying who's an ABOD, making that determination, there are noticing requirements, verbal and mailed noticing requirements around that. And we're just reminding our participants to read and follow the instructions in the notice, as it can help them to avoid losing those benefits. Next slide, please. And then I already, touched on this a little bit, but again, really want to emphasize that not only will we be talking about and working together on identifying exemptions, helping ABODs connect to qualifying activities to meet their work requirement, but that also we have an opportunity to work together on those pathways for ABODs to regain eligibility by meeting an exemption or completing the qualifying activities in 30 consecutive days. And so if someone does regain, and they stop meeting, there is a second set of 3 consecutive months that an ABOD would be eligible for. So that would be part of the regaining process. So we're just letting you know this is out there, but definitely we'll be sharing more as part of our strategy around helping ABODs regain once the time limit is live. And unfortunately, if we have those waves of ABODs who may start to lose eligibility. Next slide, please. Here, just a quick recap of the information we talked about. Time limit returns in Illinois, February 2026. The SNAP work requirement time limit means that ABODs are limited to 3 months in the 3-year period unless they meet the work requirement or qualify for an exemption. However, they can regain eligibility if they become exempt or start meeting the work requirement. They can regain at any time, as many times. And in Illinois, the 3-year period began January 1st, 2024 and ends December 31st, 2026. So all of our ABODs will have a clean slate, start a new period January 1st, 2027, which also does coincide with the Medicaid work requirement potentially going into effect. And so just know that we are also very mindful of the fact that we want to leverage the work that we're doing on the SNAP work requirement to help those who may be subject to the Medicaid work requirement when those rules come into effect. So we're not focusing on that today, but just know that that's part of what we're working on to be aligned on. All right, so let me pause here before we go into the next section on exemptions. I'll take a look at the questions in the chat. All right, so we have an anonymous question. To clarify, 80% of Illinois ABODs are at risk of losing SNAP due to revised work requirements. Did I hear that right? So I shared a slide where we looked at our current SNAP population, who would be identified as ABODs. And of those, we saw that only 20% were meeting the work requirement based on the information that we had at that time. And so that 80% comes from that, where we were concerned that based on what we saw in the system, that 80% of our ABODs looked like they were not meeting the work requirement or exempt. And those numbers have been changing, but that's what that 80% was referring to. And so, okay, let me see in the chat, and Antonio, feel free to chime in too if I'm missing a question.
There's another question in the Q&A. There's one in the chat, one in the Q&A, and then somebody's got their hand raised. So let's start with the Q&A. Can IDHS be scheduled to come to community organizations and provide presentations on this information?
Yes, and in fact, we have been doing that. There are a group of us who have been going out and trying to present to our community stakeholders. We are trying to coordinate whenever possible. As you can imagine, we know that there's so many questions, there's so many stakeholders we need to get out to, and so just trying to coordinate to make sure to talk to as many groups as we can. We are also working on, information that could be shared on the web and recordings and different tools and resources to make sure that we can also share information above and beyond when we do those community organization presentations. But yes, absolutely, we can and will continue to do that.
Next question
And
is, what are the requirements for ABODs over 65?
yeah, so those 65 and over are exempt. And so I'll get into that in the next section, but those age 65 and over, that is one of the exemptions based on age. So they are not subject to the work requirement and they would not be ABODs. So they do not have to meet the work requirement. Thank you for asking that clarifying question.
There's one more question in the Q&A, but we've had a participant have, Sabrina's had her hand up for a while, so I'm going to let her speak. Sabrina, I'm going to allow you to talk and you should be able to come off mute. It might have been a mistake, so let's continue with the questions. What defines 80 hours of activity, and would a person have to prove it each month?
Great question, and we will get to that in the section on meeting the work requirement. We'll definitely get to that where I'll talk about the types of activities they can do for 80 hours and the verification requirements around that. So great question, and we will get to that. The next section we'll talk about exemptions, and then I will talk about meeting. So thank you for that question.
Next one, will there be materials or guidance available to CBOs or workforce service providers in communicating the new requirements, or how some of these programs can help in meeting the new requirements?
Great feedback. And yes, that is the type of content that we really want to work together to be able to provide to you all. That's where I mentioned, some of these things we're just making sure we're in alignment and, that we're clarifying everything for on the eligibility side for SNAP as well as to partners. And so we are working really hard to be able to publish those kinds of materials as soon as we have that alignment and clearance, because we don't want to create more confusion. But absolutely, thank you for that idea. It's helping to lift up how important that is and how you all are needing that information. And we are working on it.
Next question is, I understand the mission of DCEO is to create equitable economic opportunities across the state of Illinois. Can Lisa speak more to how DCEO is thinking about its role and the importance of this for the DCEO mission?
Yeah, sure. Thank you for that question. So I think, as we have been moving from more of a transactional approach to a relationship approach, we have, are trying to put in place opportunities, more and greater opportunities and ways for folks to access our services. And so when we talk a little bit later, we'll talk more about what we're thinking related to virtual access. And I think, as I mentioned, it's really important for us to look at this population not as a separate population, but really one that we are supposed to serve anyway, right? Because, what our real mission is to make sure that folks either can upskill or become ready to work and then eventually, achieve self-sufficiency. We know that's probably not going to be realistic for all, but any movement that we can make towards getting somebody self-sufficient, we want to be able to do that. And so it's really important for the workforce system, I think, to be part of that, especially our Title I folks, because it is our charge, right? We are supposed to do what we can to help folks move along a career pathway. So there, not only will we be looking at ways to do that virtually, but we'll talk a little bit more later also about when Sheena talks about qualifying workforce programs. That's another role that we'll be able to play because we do have, JTED, CEJA, Apprenticeship Illinois. There are many workforce programs within DCEO that I think are a perfect opportunity to connect this population to. So I don't want to steal Sheena's thunder or steal our unveiling of what we're going to be doing. So we'll get into more of that later. Antonio, any additional questions for us?
There are a few more. If an ABOD who meets work requirement, if an ABOD meets work requirements, will the benefits be reduced?
So you may be asking, so if the person meets through paid employment and they now have income coming in, that could potentially affect their benefit amount. Yes, because once they are having income coming in, that would have to be budgeted on their SNAP case, and the eligibility worker would then determine the impact, if any, on their SNAP benefits. So that could happen. When we get into the ways to meet, there are some ways to meet that don't involve wages, in which case there wouldn't be a change in the benefit amount. If an ABOD were to lose eligibility, let's say they're in a household of 5, there's one ABOD. Unfortunately, that ABOD is not meeting or exempt and they lose their eligibility for benefits, that household's benefit amount would be recalculated without that person in the household. So their household allotment would be reduced based on that individual no longer being eligible. So those are some of the ways that the benefit amount could be reduced. Hopefully that did answer your question. And if not, feel free to add a follow-up in the chat. I am seeing some feedback on WIOA training that I think let's hold on those just until we get further on into our slides. And I think that, those might naturally fit in. I just want to address, there was one question about who to contact to coordinate scheduling a community stakeholder presentation. I will commit to sharing, to making sure we share that email address. I just want to touch base internally and see who is the right person to field those requests. And so I'm making note of that as a follow-up item for that. So thank you for that question. Okay.
I do see one person's hand raised. Do we want to take that question, or do we want to take a second?
Yeah, let's take that question and then we can go to the next section.
Fantastic. So after this question, we'll move on to the rest of the presentation. Alejandra, I'm going to allow you to talk and you should be good to ask your question.
Alejandra, it looks like you're still muted. Oh, sorry.
Yes. You're saying what I was going to say, so I think we're good to move on.
Okay. All right. But please, those of you who are muted with your hand up, if you want to put your question in the chat, we want to make sure to hear from you. All right. So this next section is about the exemptions from SNAP work rules. Again, as you heard, we have an opportunity to help those who are ready and have the capacity to connect to meaningful workforce opportunities, but those who have very real challenges and barriers that this is not something that they at this time, are able to take on. We want to make sure that they're getting those exemptions and not subject to potentially losing their access to food benefits while they're, dealing with those challenges. So next slide, please. And so I will, I know there's a lot of content on the slide, and I do want to go through each one simply because we really, again, want to make sure our SNAP recipients and all of our stakeholders understand the reasons that an individual age 18 to 64 may not be considered an ABOD and subject to that time limit and work requirement. So one thing has come up already as a question. So the first thing is around age. So an individual who is under 18 or moving my slide, under age 18 or 65 years of age or older, they are exempt. The eligibility worker would know that in the system, and they would be automatically exempt from ABOD status based on their age. Again, if they're under 18, 65 years of age or older, they're exempt. They would not be an ABOD. They do not have to meet the work requirement. Similarly, someone who's physically or mentally unable to work, and this could include experiencing chronic homelessness, domestic violence, substance abuse, and other barriers. Those individuals are potentially exempt from the work rules as well. And on this one, I just want to highlight that it does not mean the person is sort of officially disabled from Social Security, right? There's a lot of flexibility here around those physical and mental health reasons that someone may not be able to work and sustain work for 80 hours. The next one is pregnancy. Again, this is one that the would come up in the interview with the eligibility worker, and that would exempt someone. They're not subject to the work rules. Then if someone is living in a SNAP household, meaning they purchase and prepare food with a child under age 14, even if the child is not their child, even if the child is not eligible for SNAP due to another reason, if they're in their SNAP household purchasing and preparing food with a child under age 14, they would be exempt, not an ABOD, not subject to the work requirement. And that's another one that, again, the eligibility worker would be aware of this because part of that determination is figuring out who's in that SNAP household purchasing and preparing food together. The next one is, this was added actually by HR 1, that certain Native Americans are exempt and not considered ABODs. Next, if someone's caring for a child under age 6 or a person who needs help caring for themselves, and this might be someone in their home or it could be someone outside of their home. So a young grandparent raising grandchildren, someone taking care of an elderly parent, if this again is a barrier for them to be able to work 80 or more hours, this could be an exemption reason for them. Then if someone is going to school, college, or a training program at least half-time, they would be exempt, and half-time would be determined by the school, college, or training program. USDA FNS at the federal level doesn't define half-time, says that this definition is to be made by that institution. So this is one that we'll come back to later, but that I know that you all are probably having a lot of questions about this around what school, college, training programs and half-time status, like what could be this exemption. And so that's one of the things that we're working with our partners to provide some clarity on to our eligibility workers in the field and customers and all of you. So just know that we're working on that. And I'll talk about later in the slides, in the interim, the types of information that they could submit for that exemption. The next one is someone who's meeting the work rules for TANF. They would be exempt, and that's something as well that would be known in our eligibility system. If someone is receiving unemployment benefits or they've applied for unemployment benefits, someone participating regularly in alcohol or drug treatment program, and this is beyond like Alcoholics Anonymous, AA, and NA, Narcotics Anonymous. This would be sort of regular participation in a more intensive alcohol and drug treatment program. And then this one is really critical, is if someone's working 30 hours a week, they would be exempt. So again, if someone gets to that 30 hours a week number, they're actually exempt. They would not be considered an ABOD. They don't have to meet the work requirement. They're doing the 30 hours. The other note is if someone's earning at least $217.50 a week before taxes and deductions, which is the federal minimum wage of $7.25 multiplied by 30 hours a week, that person would be exempt. That's one of the federal exemptions. And so in Illinois, because our state minimum wage is $15, that would be around someone working 60 hours at $15 an hour might meet that threshold and actually be exempt. So just something to be aware of is working 30 hours would be an exemption, but also if you meet that dollar amount of $217.50 with your work hours, that would also mean that you're exempt, you're not an ABOD, and not subject to the SNAP work requirement. Okay, next slide. And we have on our IDHS abe.illinois.gov website. You can see where the red arrow is. Individuals can go to abe.illinois because this is where SNAP recipients can go to manage my case, where they can see their case information, they can upload documents for their eligibility workers. And so this is a place that we really want to make sure our SNAP recipients and partners know that this exists for Manage My Case. We're hoping to do some more trainings and have videos and things so that people know how to use Manage My Case. But if you go to this web address that's on the screen, where the red arrow is, it says check if I meet the work requirement. And if you click on that, it'll take you through a series of questions to help someone identify if they meet one of the exemption reasons that I just went through on that last slide. And if they do meet one of those reasons, it will link them to that referral request form. and other resources to help them in requesting an exemption. And if they're not exempt, it would help explain the work requirement. So we have this as a tool to help you all and to help customers navigate that. You don't have to log in or anything to use that screening tool. Once you open it up, you just navigate through a series of questions. The first one is date of birth, simply because of the age exemption, so that you enter your date of birth, and if you're under 18 or 65 and older, it will tell you don't need to meet it, but you don't have to log in or create an account or anything like that. So wanted to make sure you all knew that that tool exists for our customers. All right, next slide, please. And, for that exemption request process, customers can request this at any time. They can they can go into their local FCRC, they can call, again, through Manage My Case, they can submit that request for exemption form through the Manage My Case portal. And so we, IDHS, mailed out that form to individuals who were identified as potential ABOTs so that they also got information about that form. Next slide, please. And this is just a screenshot of the form that 2341 request for exemption. The individual would enter their information, and then you could see where they can check the box for if one of those exemption reasons applies to them. And again, if you go through that screener tool, it will give you the direct link to this form. Okay, next slide, please. In some cases, when an individual requests one of those exemptions, the eligibility worker at the FCRC, they're the ones who determine the exemptions. And in some cases, they may need additional documentation. And so one of the resources that is there for partners is a Form 2340 that I'll share on the next slide, which can be filled out by a broad range of partners who work with our customers, healthcare professionals, social workers, drug and alcohol treatment providers, homeless service providers, DV service providers, where they can fill out this form to indicate if the person needs to provide additional documentation on any mental or physical health barriers, if requested to do so by their eligibility worker who's making that determination. Next slide, please. And just sharing again a screenshot of that unable to work determination form that community partners can help our SNAP recipients fill out if that exemption applies to them. Next slide, please. I think this just shows the second page of the notice with, again, the range of different stakeholders who can help fill out this form. All right, so that was the exemption question. So again, I'll pause here again to answer any questions in the chat or the Q&A. And Antonio, if you could help me wade through them, that would be great. If there's any specific to exemptions, any of them that are sort of about training or meeting, I promise we'll get to in the next section. Go ahead.
There were a couple of questions in the chat. Most of our WIO partners have limited capacity for training. If they are signed up with a partner, does that count as participation for those 80 hours? Also at IDS, we host job fairs and workshops. Would those count towards the hours?
So we'll answer that in the next question. So we'll keep that one up, and so we'll answer on the next question. And I think also David Taylor's question, I'll hold that one as well for the next section. Let me see.
Sounds good. That's all that I can see.
Oh, I do see one. How long is an exemption in place? For example, if a person applies for UI but ends up not eligible for UI, will they then become not exempt the following month? Yeah, so great question. So there are policies in place where if somebody does lose an exemption, the eligibility worker does need to screen them to see if another exemption reason may apply before they start applying countable months. And that is because, I might have, as a worker, screened someone in January, and at the time they got the exemption for unemployment. 2 months later, they were not eligible, but in that time, they became a caretaker for their for a sick family member, for example, right? So just so you know that the exemption will be in place as long as, whatever documentation indicates that it's in place. And if it's something like, UI that may end, the eligibility worker will be reaching out to screen that person to see if another reason applies before they would be determined to be ABODs and their months could be counted. Okay, I think that, all right. We can move on to the next section. Oh, go ahead.
Sorry, Sheena, this is Lisa. So did you see the question on the exemption when somebody's in a GED program?
Oh, let me see. Oh, I'm wondering how working on obtaining a GED, can that qualify as an exemption? What is halftime for a GED, or does that not qualify? So this is a great question, and one that, again, we're sort of working to make sure we have clarity on in terms of what is the exemption pathway and what is the meeting pathway. So for this one, we're going to hold this one in the FAQ, but just know these are the types of questions we're actively working on because we know you all are wondering, you want to know this information, but we need to just have get a little bit more clarity on our end before we communicate out to you all. So like I said, I'm making a note that we are actively working on that question to give you those specifics, but I don't want to answer it quite yet. Okay, let us go on. So now we are shifting to talk about how individuals who are identified as ABODs, they don't meet one of those exemption reasons, how they can meet the work requirement. And so the next slide will talk through what you all have already started asking about to that effect. Just as a reminder, who must fulfill the work requirement? Who are these ABODs? They're individuals ages 18 to 64. They are, quote, fit for employment, right? We know these are sort of loaded terms, but sort of like the federal terminology, they are fit for employment. They don't live in a SNAP household with a child under age 14. They're not pregnant. They're not already exempt based on one of the reasons we talked about. And they're not covered by a time limit waiver or a discretionary exemption. And Illinois would not have in February either of those things. So that would not cover somebody. So that's, again, just a reminder on who our ABODs are. And then next slide, please. So our ABODs are required to spend at least 80 hours a month working. And working in the SNAP rules means paid work, unpaid work, in-kind work, community service, volunteering, all of those things kind of fall under that bucket of work. Then we have participation in what's called a qualifying work program. The ones that are defined in the federal law and regulations are SNAP Employment and Training, which again is managed through my Office of Workforce Development at IDHS. WIOA Title I programs are specifically mentioned. And then the rules allow for other approved federal, state, or local work programs. And this is one of the things, again, that we're really working actively on with our state and local workforce partners to identify that list of approved programs. And so we have, this work in progress. Again, that question about the GED sort of, falls into this bucket of clarity that we know that you all have questions about this. And so the ones that are very clear, SNAP Employment and Training, WIOA Title I, Trade Act programs, employment and training programs for veterans. Those are very clear and explicit in the SNAP rules, but then there is the potential for other approved work programs to meet this definition, and we are working on clarifying that for all of you. And so that's one of the things that as soon as we have that clarity, we will share out with you all. And then in addition to participating in the qualifying work program for 80 hours a month, you can also do a combination of working and participating in a qualifying work program. So you could do 10 hours of work, 10 hours of a work program. You could do, 10 hours of paid work, 10 hours of community service. And so, any mix of these qualifying activities would work for an ABOD to meet the work requirement. I do have just like that quick note, because some of you on the call may be our SNAP employment and training providers as well. There is a separate activity right now offered only through SNAP employment and training where individuals can do community service to work off their benefit amount, and that is a lower number of hours than 80 hours. So I don't want to spend too much time on it, but just saying out loud that under SNAP BNT currently there is another pathway that's less than 80 hours, but that is, specific to our SNAP employment and training providers working with participants. For those not in SNAP BNT, it's the 80 hours, again, of work program, a combination of those things. Okay, and I think this is another place I will turn it over to Lisa.
Yeah, so I don't really have too much more to add because I think in the previous slides, we've kind of talked about this, of looking at ways the Title I folks can help and our DCO in general. So there's going to be more to come on these efforts. Sheena has mentioned some things that we're still looking at internally, like related to what's a qualifying work program. Certainly, JTED, because it's very focused on employment and training, could potentially become one of those qualified work programs. Our CJA in the same boat. Illinois Works, which is our pre-apprenticeship program, that's also another opportunity. So, I think today is really just to kind of give a background and set the stage and give some information. But certainly more information is to come. And I am going to talk a little bit about the virtual access program in just a couple of minutes. So Sheena, I think you have one or two more slides and then we can kind of get into what the virtual access is going to look like.
Yeah, and actually, I'm just going to pause and mention one thing because I saw one of the questions made me think about it, where someone said, if someone is enrolled in an adult ed program through a community college, do their classroom hours count toward the hours requirement? And that's a great question. And again, some of that is we're going to work on that clarification on, is that an exemption or is that meeting? But I did want to, your question made me think about, like, under the participation in a qualifying work program, we understand that there's, there could be homework, there could be study time, there could be all of those things. And so just know that in a work program, that 80 hours, keeping that in mind, right? That there could be time spent towards that program that's not just in the room, in the classroom with somebody. And so just know that we're looking at someone's in a program that's designed to be 80 hours, which may take into account their study time and homework time and, self-study and all of those kinds of things when it comes to that work program participation. So I just wanted to mention that. And of course, absolutely, we have your question about the GED program and the questions about that on our list. And I will share a slide on, again, current state while you're waiting for this clarification, what you could submit in the interim. But again, just know that we're trying to work through to make sure we have clarity on that. And so I think that was it for the slides on meeting. Let's go into, we can go to the next section, I think, Lisa, before pausing for Q&A. What do you think? Because I think this might answer some of the questions.
I think so too, yeah.
Okay, all right. Next slide, please. So here we want to talk through how we are going to be supporting ABODs because we know this will require that coordinated effort that we've been speaking to, and including SNAP BNT providers, WIO providers, community colleges, and other state and local workforce partners. And our goal is to work with all of you, again, to help those ABODs who, those who are identified as ABODs because they're able to work and, or be in a work program and meet this requirement. Really to connect them to the best opportunities to meet them where they're at. And so on the next slide, I'll speak quickly to some of the ways that IDHS is preparing for the return of the time limit. We've, talked about some of this before around educating and engaging our participants and also partners on the exemption pathways, ways to meet. We're working on communications and outreach plan and trainings for partners. And again, I will definitely share the email address for where you should send any requests for those presentations so that we can, again, kind of take that coordinated approach to doing those. Also looking at, I know someone earlier mentioned like toolkits and resources and videos and all of those things that we are going to work to be able to share those as soon as we can. And so we're working on that. Second item, we are working to expand our voluntary SNAP employment and training program. Again, that's housed in my office at IDHS to help ABODs meet the work requirement and make sure we have statewide coverage. Right now, our program is primarily Cook County, and we know that's a huge gap. So we're working really hard to expand statewide. And I just want to reiterate that our SNAP employment and training program remains voluntary, and just that's a message across the workforce system, right, is that of course, we want to do everything we can to help ABODs meet the work requirement. And, we also want to help additional SNAP participants who want to engage in the workforce system to get, the help that they need as well. And with our SNAP employment and training program, it's one option for an ABOD to meet the work requirement, but they don't have to participate in SNAP employment and training. There won't be any sanctions or direct consequences of them not participating in our SNAP employment and training program. So that's what we mean about that program remaining voluntary. And I just wanted to mention that because some of you may know that in years past, our SNAP employment and training program was mandatory, where individuals would be sanctioned for not participating, but that is not the case currently. Our program will remain voluntary. It's an option for ABODs. We're trying to increase our geographic coverage and our slots, but it will remain voluntary. And then, of course, we're going to speak to this, but just that we want to strengthen and align our existing workforce system to make sure that all of us are working together to best meet our customers, look at opportunities for lifting up new programs where it makes sense, and looking at how we can connect the dots to existing programs. And as I mentioned earlier, really having an eye on when Medicaid work requirements will come into effect in 2027 to make sure we are well positioned to build this infrastructure to also help those Medicaid recipients. Just so you know, I think some early data showed that 91% of Medicaid recipients are also receiving SNAP. So as I said, there's opportunities there where if those Medicaid recipients are on SNAP and we're helping them meet the SNAP work requirement, that will exempt them from the Medicaid work requirement. But we also want to think about those who are not on SNAP and how we support them. And our partners are already starting to think about that. Okay, next slide. This is what I was alluding to, that I know that we want to have some more clarity to make this process a lot easier and more streamlined for all of you in terms of verifying that exemption for that half-time enrollment in a recognized school training program or institution of higher education. And also then if it's not that exemption and they're meeting, how to verify that someone is meeting through work program participation. So, as we're working on that additional clarity and sharing that information, but we know that some of you all are having customers walk into your doors and asking for assistance. So I worked with our policy team to share here some bullet points on the type of information that would be helpful in the meantime to submit. Again, we want to make it even easier. We're thinking about different forms and tools and all of that to make this more clear and easier, but we know that you have maybe some immediate needs to help customers at your door. So what we would recommend at this time, and someone had asked, for example, how often. So for ABODs, they would have to provide this documentation up front to show that they are enrolled in this program and give a sense of, how long they're going to be enrolled in this program. And then at their renewal, when they have to renew their SNAP benefits, they would also have to provide that documentation at that time. So again, it would be upon enrollment or once they realize, oh, I'm identified as an ABOD, but I'm in this program. So providing that up front so the eligibility worker makes the determination, codes the case accordingly, and then they would be asked to submit it again at renewal. And so we're recommending that if you are working with a customer to submit documentation at this time, to include their name, the customer's contact information, if they have, their case ID or that kind of information that they can also get from Manage My Case or their notices, certainly include that, a description of the program name and a brief description. So again, if it's like GED through a community college, or if it's WIO Title I, or, a Trade Act program, or, one of those programs, just to say that what the name is, when they started it, anticipated end date, if applicable. If it's a program that they are in on an ongoing basis, you could indicate that. But if it's something that that it's time limited, you could put that end date in. The number of anticipated monthly hours. So again, if it's a program that you anticipated they would be doing at least 80 hours, indicating that in there, Or again, if you are a school training program or institution of higher education that goes by that half-time status, you can also indicate that, that they are enrolled half-time or more or full-time or whatnot in your program. So, based on your program design, you can share it as half-time, full-time status, or the number of assigned monthly hours. And then it is helpful if you could include contact information in case the eligibility worker wanted to reach out. So again, this is what we're sharing as sort of current state. If you have someone coming to your doors wanting help to submit documentation, this is what we would recommend you submit. Again, we're working on additional clarity in terms of specific programs under each pathway and forms and, additional information to help you all. But in the interim, this is what we're sharing. All right, so next slide, I will turn it over. Lisa, do you want to talk through this one?
Yeah, great. And David Taylor, thank you for your comment and suggestion on ways that Title I can help. So to really try to help as quickly as possible, we are working with the Illinois WorkNet team to stand up a virtual area for ABOD customers to come to so they can start receiving information and working on things that can help them immediately meet their work requirements. So we're going to be, it will be a link specific to this population. It will not be a public page. So we're working with DHS on ways to get that link out for those that want to participate or aren't already exempt. And it's going to have access to, we've worked real closely with ICCB to provide some informational sessions on, receiving adult ed services. What are some of their various programs like enrollment in their workforce empowerment initiative, where bridge programs are. So they'll be supplying us with a list of webinars and some related information on how to work more directly with CTE and adult ed and community college programs. We will also have informational basic career services in this area so that folks can do that, access it, can do things like resume writing if they want to increase their resume or if they just need to build a resume at all. We will also have access to skill assessments through this portal as well. So folks can see, like, if they want to change careers or they want to find work, we can link them up. Also, we'll have an access to, to Illinois Job Link on this page. We will also, connect to if somebody needs financial aid, we'll have a link to that. We are also going to provide access to, I'm not sure if all of you are on the call are familiar, but I know probably more than half of you are with Employment 101, which is really just a guided path to, what you need to think about when you're looking for work. That we'll have access to that. And also we're going to have access to digital literacy curriculum. So those are just some samplings of some things that we're going to offer through that portal. And so hopefully the plan is to get that portal launched after the first of the year. So we'll be, be looking for that link. And I think too, we will also, if you want to connect to your local area, if you want to connect to your FCRC, we will also have areas set up so that they can contact either the FCRC directly or the WorkNet Center directly. Will have access to those links as well. So, and certainly welcome suggestions for other things that we can put on there because we want to keep it, dynamic and living so that the information and services that we do have on there will be, we'll be able to count towards the folks 80 hours. So we're really, focusing on what we can put on there for that 80 hours. And also, if, they do reach out to you, our hope is that this is just the stepping stone. And, we can connect them also to, as I've mentioned a couple of times now, the JTED program and other services. So the second sort of pathway, would be those that are ready. Like, how can we get them enrolled in Title I? How can we get them, enrolled in adult ed? So we're going to go from, more self-directed to intensive workforce services. And then, I think, we've been, really pushing and wanting to reinforce this clear messaging about how you can meet the work requirements and where do you go to do that. So that is kind of our, first immediate response. So I did this in mind with, that the work requirement was going to end sooner than it is. So we have a little more time now to build this out. So I hope it's going to be a really good dynamic platform for the population to meet some of their work requirements. We will also have a tracking mechanism on there. So once they get the link, they'll register, if you will, and I'm using quote unquote, so that we can share that information with DHS so they can see which of their participants are using the virtual platform to meet their work requirements. So happy to take any questions on that. I did see something in here that I wanted to add. There's a question in the chat. I know it's about an RFP for CBOs to apply for SNAP ENT services, but I want to just do a shameless plug, if you will, for JTAD. So we do have the notice of funding opportunity out for JTAD. And I would encourage you, if you didn't participate last week in the orientation sessions for the application process, those are online and recorded. You can also, reach out to me about the opportunity and we can connect you, but that certainly would be, some funding available to help DHS expand the services for this population.
Thanks, Lisa. And again, I just really want to applaud DCO, ICCB, IDES, all of our partners who have come together to launch this virtual SNAP workforce initiative. Again, this is an example of how we all came together and came up with a creative opportunity to be able to serve more ABODs statewide. And again, it might not be the right opportunity for everybody, but it's another pathway that we're offering, and when they're ready, again, transitioning them to more intensive services. So again, really grateful for the collaboration, all of the capacity people have put into helping to lift up programming like this. And this is part of the way that we definitely want to work with you all. Again, let's maximize what's existing and let's look for opportunities to add in ways that are strategic to help meet the need right now. So again, really so thankful for our partners working with us on this. And so next slide, we are now at our Q&A portion, and I see some questions in the chat. I wanted to answer the question around the RFP, or what we call Notice of Funding Opportunity for SNAP Employment and Training. So we will keep you all in the loop when there is a new NOFO to be released. At this time, we are not planning one, but that is on our radar, to think about when is the opportunity to release another NOFO. And so we will make sure to be sharing that with all of you when we have a new NOFO for SNAP Employment and Training. So thank you for that question. And okay, how often is renewal of benefit? So that's a good question. So, one of the things I didn't talk about, but that, IDHS will definitely be sharing more information, and there will be other presentation on that, is because of the payment error rate, and the risk to the program, with states having to cover a portion of the benefits and the $800 million that Illinois could be on the hook for starting in 2027. IDHS has really been looking at a lot of policies, and there are some changes. So you may be aware that SNAP recipients had been able to get up to 12 months with a 6-month midpoint report. And I think for some of our elderly and households with disabilities, they had longer, but we are looking at transitioning to 6-month renewals. So again, depending on, the timing and that person's specific circumstances, the eligibility worker would assign them that certification period, but we are moving to 6-month renewals. So you may be starting to hear about that. And the question, is there a specific document that you want Title I to send you for verification of involvement? We do not require a specific document, just know in general with SNAP eligibility, we can't require like one specific thing. So, use your best information on the documents that, again, might provide that information. That's SBO Title I, who's enrolled, the hours, that information that was on that prior slide. We are working on a form to help with both that exemption and the qualifying work program path, not because you would have to use that form, but just we know that that takes the guesswork out and just makes it easier. So we are working on that. But in the interim, you all can use your discretion in figuring out the right document that you think has those types of details that I mentioned on that previous slide. It's not one specific thing we're looking for. Another great question around if they're not digitally literate, is there another way being created for ABODs to submit their hours? So I do want to clarify too that an ABOD can always, to provide documentation, they can always go into an office. They can also always call. So there are other pathways, but definitely the digital literacy thing in terms of the virtual training is something on our minds. And Lisa, you might have been about to chime in. Go ahead.
Yeah, sorry. Yeah, I was. Yes, we are looking at that. We have another project going on right now that is Partners for Re-entry Opportunities in Workforce Development. And because we're in the federal prison system, they don't have access to the web. And so they've designed some digital literacy curriculum for those that aren't able to access computers. And it's a really good, strong curriculum that we intend to look at and update so that we can offer it, either in the FCRC or, we could do a group set, have somebody come into the WorkNet Center and not necessarily a Title I person, but we would have somebody come into the WorkNet Center and offer that curriculum as a way, to help that so that they can then get on the WorkNet platform. Sorry, I lost my train of thought for a minute. Get on the WorkNet platform to actually take the online digital literacy course that we have. That I'm going to give a shameless plug for that as well. We have a new curriculum that we've developed. It's called Digiscape, and it's actually a digital literacy curriculum that is in a game format, and it is super, super cool. So we have been piloting that and are going to kind of roll it out to a broader audience through this effort. So.
Thanks, Lisa. There's another question around, will providers be required to meet in person for regular staffings again? That's probably related to our SNAP Employment and Training Program and our TANF E&T. We have what are called staffings where we meet with providers monthly. So we are not requiring at this time any in-person regular staffings. Our team is continuing to meet monthly with our providers, but we at this time are not requiring to meet in person. I did also just want to go back. Jennifer Vega had asked a question earlier and asked if they're signed up with a partner, does that count as participation for those 80 hours? And again, hopefully, Jennifer, we answered that part of your question. And you also asked, at IDES, we host job fairs and workshops, and would that be considered participation for those 80 hours? So that's another one of those complicated questions because as you saw, it's sort of participating in a quote qualifying work program. So it is not really in the regs as something where an ABOD is like, oh, I did this job fair, I did this standalone workshop, kind of like piecing together each month in that way, 80 hours. However, it could be something where if they're working with a partner and they're getting additional time in addition to doing some job readiness, they're doing a job fair or workshop, those hours could count. So I know that it's a little bit of a complicated question, but I hope that makes sense that it could be sort of qualifying work program means, again, sort of under that umbrella of like, this is a designed program, but that program could include some additional workshops, job fairs, and things like that as part of building of that program. But that is also part of the types of things we want to clarify for you all. So appreciate you raising that. And then, okay, curriculum is great. However, what are the mechanisms being put in place to ensure that we reach individuals who may not have an email address or access to computers, internet? As Lisa mentioned, that's very much on our mind. We're excited about this virtual option, but we know that that's not going to work for everyone. And so we are still, working and thinking about how to work with all of you on additional options for those for whom that's that's not the right pathway because of digital literacy is too big of a gap. And Lisa mentioned some of the ways we're trying to bridge that gap, but for those where we are not able to bridge it, we are thinking about that as well. And, more volunteer opportunities, more, in-person connections. Lisa, anything else you wanted to add on that?
No, I think
Okay.
that was a great response. Yeah.
Okay. I'm wondering how you will address the need to get enough places for people to obtain volunteer hours. If they're not able to work, perhaps do not have work experience or do not want to work and have their SNAP benefits reduced. I feel it would be difficult to find enough places willing to offer volunteer hours for those that may need them. Yeah, thank you for your feedback. We are, that is, again, one of the things that we're actively working on is getting those lists of potential volunteer opportunities, thinking about the most streamlined way to share them with customers, to connect with them. I know that, again, our FCRCs, the local DHS offices, they're out there actively trying to find, pantries, libraries, senior centers, other places that may be able to take volunteers. So that is another track that we are working on and exploring with our partners here at IDHS. And so definitely, if you have ideas, please share them with us because we hear you that right now we are trying to just find enough places. And again, statewide, making sure that there aren't a lot of gaps for ABODs where in one place they might have a lot of resources and in other places we know they might not have transportation, they might not have a lot of resources near them. And so that's part of our landscape mapping and figuring out how we can meet those needs. So yeah, appreciate that feedback. And we are really trying to work on that. And again, if you have ideas, please share. Okay, let's see. What can be done to assist cognitive delayed adults? That's again a good question we'll take back. Again, if you think that individual would want to request an exemption due to a mental or physical health barrier, that is an option for them. And then they may be exempt from the work requirement in ABOD status. And so they could request it. And again, the eligibility worker would make that determination, but that's one option. And we can also, of course, be thinking about that population as we're also designing our program, like the set of programs to meet and add as an exemption. Okay, are resources being allocated to provide transportation support, bus cards, Uber, Lyft, cab fare, now that they are being required to leave their homes when they might not have those needs available? Yeah, that's a great question. Some of our programs have those kinds of support services built in, like SNAP Employment and Training does. That's where some co-enrollment opportunities, blending and braiding funds to be able to provide that is helpful. And I appreciate you flagging that because that is, again, something, a good suggestion as something for us to explore. So I know that places like nursing homes, hospitals need volunteers, but some in this population may have backgrounds that would eliminate them from volunteering at such places. Thank you for raising that. We know that, again, we have to have a lot of different options because not all places will work for all individuals. And so, yeah, absolutely. We need to be thinking broadly about the types of opportunities that we're offering so that we're not leaving people out. And so definitely wanting to do that equity analysis, in terms of geography and other factors for our ABODs. You see, Antonio, have we missed questions?
Don't believe so. I know there are a couple of resources that have been shared, like Volunteered Untapped, and then there was a link in the Q&A as well, but I don't see any other questions. Does anybody have any questions or would like to raise their hand to come off mute?
And thank you to the person who shared Volunteer Untapped. I will make note of that. And there was a comment, thank you for addressing Action for Children for SNAP recipients. I wasn't sure, was there a question related to that or something you wanted to make note about Action for Children?
That would be Bernadette.
Bernadette, please feel free to add to the chat if there was, I want to make sure we either address your question or share out if that was a resource that you were sharing. Will you send us a link for partners who want to sign up for volunteers? Oh, like organizations that would be willing to host volunteers. That's a great idea, and I am making note of that as something on our list to share out. So thank you for that suggestion.
I see one more question. Who would pay for background checks for places such as mentioned above? If it was the businesses, they might not choose to participate.
I wonder, do you think that person means for volunteering opportunities?
I'm not sure. I apologize.
No, that's okay. Yeah, I think again, unless this was through a program that offers supportive services to cover things like background checks, that would not be something that could be covered. Again, I'm taking back the questions from you all about the types of supportive services that could be offered to this population outside of those programs. Okay, so yeah, background checks for volunteering opportunities like nursing homes. Yeah, thank you for lifting up that question. We don't have a source of funding to pay for background checks for volunteers at this time, but I'm making note of that as, something that we can explore.
And then I do see that Bernadette raised her hand. So Bernadette, I'm going to allow you to talk. You should be able to come off mute and ask your question. Bernadette, you're muted if you are wanting to say something.
Can you hear me now? Hello, hello.
Yes.
Yes.
Yes, we can.
Okay, good. Thank you. Thank you for unmuting me. Action for Children has different qualifiers for SNAP recipients that are going for GED, that's not working, no income. So if you could reach out to them or partnership with them, because if you're looking for people who have children that has to be engaged doing something, childcare would be an issue. Does that make sense?
Yeah.
Say, hey, I'm an ABI, but I got this child. You know what I mean? That's a big one. That would be a big resource for us.
Yeah, thank you for lifting up, the importance of connecting with groups like Action for Children, and just Bernadette, just making sure too that that if the ABUD in their SNAP household, if there's a child under age 14, they would be exempt and not an ABUD and not have to meet the work requirement. And so, that may help a little bit with that. But, of course, we're looking at childcare gaps and things like that. I was just in a meeting earlier where that had come up. But yes, for this population, just note that an ABOD would not have a child under 14 in their SNAP household.
Yes, I agree. I totally agree. But it's always the one exception. But I want to go to school. I want to do this. I'm not ABOD, but we can't say no. But which, for supportive services, that's the one thing we always kind of say, well, what do they qualify for child care?
Yes, thank you for sharing that. I was talking with a group earlier today, and that came up just for our SNAP participants, that gap around childcare needs. So thank you for lifting up Action for Children's work.
Thank you.
Okay, let's see. Once you get information, would you be able to send out an email to participants detailing who you want us to contact to schedule IDHS community stakeholder meetings? If not, how are you planning to share that contact? Yes, I will make sure to work with DCEO to send out the contact information for that and any follow-ups to those of you who registered to this webinar. Okay, will this cover the school breaks, time out of school? So if the individual meets that exemption for enrolled half-time in a recognized school training program and institution of higher education, there may be flexibility to continue to cover that during, school breaks and things like that. With the meeting pathway, that's again something that we'll work to clarify. So we'll make sure again, to take that back as something that we want to clarify as we share more information on those two pathways, either the exemption pathway or the meeting pathway. For the meeting, they would likely have to find something else during that time because it is sort of month to month to month. But again, with the exemption, it may be different. So we'll share that information with you all. Oh, for the children who are 14. Got it. Thank you for the clarification, Tammy. Yeah, just having a child under 14 provides an exemption, and it's not contingent on school breaks, time out of school, anything like that. It will be an exemption based on their SNAP household composition. So they would be exempt as long as that individual is in their SNAP household. Serve in Illinois. Yes, thank you for sharing that. We at IDHS, we have a volunteerism bureau that's in our Office of Positive Community and Youth Development, and we are working with Serve Illinois actually and our volunteerism bureau on that volunteerism track that I mentioned to you. So absolutely, we are right there with Serve Illinois, are working hand in hand with them in terms of expanding volunteer opportunities. So thank you for sharing that link so that I made sure to mention that. That again, our IDHS Volunteerism Bureau works closely with them, and they're the ones kind of leading this work on the volunteering path. All right.
Tammy has her hand raised. If you want me to.
Go ahead, Tammy.
Tammy, I'm going to allow you to talk. Oh, she just lowered her hand, so it might have just been a mistake.
Okay.
I'm not seeing any other questions.
I think we have 5 minutes left. Is that right, Antonio?
Yes.
Okay. Oh,
Okay,
Tammy, your
raise
hand
your
is
hand
back
again.
up. Yeah.
I'm going to allow her to talk. Tammy, you should be free to unmute.
Okay. My question, I appreciate what you gave me, the information you gave me, but I was really speaking of that parent, that single parent who has a 14-year-old, and they have to go and participate in the program, but school is out and they have no one to keep their children while they go and participate.
Yeah.
Hello?
Yeah, no, I hear you. Yeah. So yeah, an individual like a single parent who has a 14 to 17-year-old, they would be an ABOD and subject to the work requirement of doing the 80 hours of, work, again, paid, unpaid, in-kind, volunteerism, or work program or a combination. So they would be subject to this. Again, if they there was a need for them, their child wasn't able to take care of themselves and they're needing to be home to provide, that care for that child. That's something where they could request an exemption. Again, depending on the child's circumstances, if they're needed to, be there for that reason because that child can't take care of themselves, that person could request an exemption, and the eligibility worker would explore the unique circumstances and make that determination. But yeah, it is. And again, this is new. This just happened with the HR1. Before that, if someone had a child 17 and under in the home, they would have been exempt, but HR1 changed that. So now it's under 14. So this is a new population nationally, of those who have those 14 to 17-year-olds in those households who are now subject to being ABODs and the work requirement. And we know that brings a lot of new challenges because that population was previously exempt. So I think with that individual, helping them explore if there's an exemption reason, exploring some of the different opportunities we're talking about.
Thank you.
Yeah. And again, just stressing that these are the federal rules, that Illinois has to offer and, has to follow. And, that these are, again, new rules that we are having to implement. All right. I'm not seeing any new questions in the Q&A or the chat. So I think we did have just a couple of final slides I'll go through, and I realize I left it to 2 minutes. Hopefully I can get through this. So really quickly on Stay Engaged, you can go to the next slide, just that you all can help us play an important role educating these changes, helping them navigate them, providing feedback on language and tools as we begin to share them, and lifting up any challenges your clients are facing really will help us learn and adapt and think about what other tools and resources we need to have in place. Next slide, please. I wanted to highlight on our IDHS website, we have our SNAP Federal Impact Center. Please know that this is updated with all of the live updates. So again, when there was a risk to November benefits, that was listed on this page. When we were able to issue November benefits, we immediately updated that on this page. When the time limit live date shifted from December to now February, where again the work requirement is in effect starting February, that was also updated on this page. So really hope this will be a helpful resource for you all, that again, this will be the place to go for any of the updates related to the work requirement and all of those other changes that we have been talking about with the federal law and HR 1. Next slide, please. Okay, yes. So just really wanted to thank you all so much for being here, for your time and attention, your great questions, and your partnership and commitment to supporting our ABOD population and helping our SNAP population in general to, again, explore exemption pathways and connect them to meaningful, appropriate workforce opportunities for them. We look forward to continuing to engage with you all. You will hear more from us on the IDHS Federal Impact Center. As we launch new tools and resources, we'll be sharing those. Again, as we have more clarifications for you all on exemptions, qualifying programs, we will be sure to share those and just look forward to that ongoing dialogue. And again, thank you all so much for the great questions and feedback that you lifted up to us today.
Yes, thanks everyone. We really appreciate it. We'll be in touch.
Thank you so much, everybody. Have a wonderful day.
Thanks, you too.
Thank you.